Do you hate going to the dentist? According to the American Dental Association, this seems to be the case for more men than women, and then men put off a trip to the dentist for years. Our guest, Dr. Marko Kamel of Woodbury Dental Arts, joins us now with, why do men do that? Are they fearful?
That is true, and most men are more fearful of their dental work than the females.
Mm-hmm. So it's your job to kind of put everybody at ease.
Yes.
Okay, and you do have a special tool, and you're going to tell us about that in just a second, but you have a comprehensive philosophy. Mm-hmm. You want to do care kind of year-round and kind of address it from a bunch of different angles.
That is true. We kind of are holistic, and we check the masticatory system in general, so we kind of ourselves as the physicians of the masticatory system, and we do check joints, muscles, in addition to the teeth. Nice.
Okay, so you brought a little thing with you, mm-hmm. and this is going to help my fear of going to the dentist, or at least men's fear?
Yes.
And what is it?
It's more of my fear, for sure.
Okay.
And it's a small tip that has a plastic vibrating area, mm-hmm. and it's plastic, and it's really just applied on the gum level. It has lots of vibration, as you can see here.
Oh, right, okay, yeah.
In addition to the light,
mm-hmm.
and it does three things. Number one, it blocks the feeling of the pain from the Novocaine shot, mm-hmm. and that's because the sensation of the vibration reaches the brain quicker than the pain sensation.
How interesting.
Yes, that's number one. Number two, it always distracts the patient mm-hmm. from thinking about the Novocaine shot, because with that buzzing sound mm-hmm. going on, mm-hmm. the patient keeps thinking, what's that you're putting in mm-hmm. my mouth? Mm-hmm. And then the third thing, that it dissipates the effect of the Novocaine on a bigger area.
No kidding. And what's the light for? Is that just so you can kind of see where it is? Where the
light is, it's pretty helpful, because mm-hmm. All what we do is just to stick the injection needle between these two tips, so it kind of like work on the whole area.
Okay. And so when guys come to you and they say, well, I haven't been here for a while, you know, how do you convince them that perhaps coming in and seeing you a little more frequently is the best way to go?
It's how simple it is, and how we can get them to be numb mm-hmm. without any pain. Mm-hmm. People can go to the extent of IV sedation and lots of other intense ways, mm-hmm. but that gets some risk of life-threatening conditions, mm-hmm. for sure. Mm-hmm. So if we can get rid of the pain with no medications and without putting the patient under risk of sedation with such a small instrument that doesn't really cost us much, the feedback from the patients and their ability to come back for more frequent visits is more.
Excellent. What's the name of this again?
Dental Vibe.
Dental Vibe. Well, thank you so much for educating us about Dental Vibe. We appreciate it.
Thanks.
Again, for a link to Woodbury Dental Arts, just head to Kare11.com, click on local, and then click on the 4 p.m. news.